Hi, I'm Dr. AC Goldberg. My pronouns are he, him, and his, and I'm a speech language pathologist.
Hi, I'm Ruchi Capola. My pronouns are she, her, and they, them, and I'm a speech language pathologist and vocalogist.
We are bringing to you a series of courses that are about gender affirming voice modification services, and we are going to start with cultural responsiveness.
AC, I'm glad that you brought up cultural responsiveness. So when we connected with Dunvey and Muncie from Talk SLP, they talked about how cultural responsiveness or cultural humility training doesn't take up a lot of their graduate school training time, pretty similar to how it is in the United States. However, cultural responsiveness and cultural humility training is so important irrespective of who your patient is and understanding where they come from, if they have financial limitations, how are they perceived, what are their access to resources and care, and that's quadruply important for the trans and gender not conforming community.
As someone who is transgender, who has in the past had clinical services and had to go to the doctor, I can always tell when a professional or provider hasn't been trained, and it makes me less comfortable and it makes treatment less effective. I can tell when someone hasn't been trained because they don't know how to interact with me. And regardless of how great you are as a voice clinician, you won't be as effective if your clients don't trust you because you have a hard time interacting with them because you don't understand their perspective, or you don't know the basic vocabulary around how to talk to them about who they are.
So if you don't invest in cultural responsiveness or cultural humility training, you're not going to be able to mindfully implement all of those perspectives into your interventions and get buy-in and motivation from your client and your patient towards their goals.
So what we're going to bring to you is a multiple part series, starting with cultural responsiveness and then getting into the clinical elements of gender voice modification. And we're very thankful to Muncie, Tumby, and Talk SLP for this opportunity. And we hope to reach you so that you can best provide support to all of your patients and clients, regardless of what type of service you're providing.
AC and I are so excited to be able to engage the South Asian speech language pathology community in this discussion.
Thank you so much. We'll
Thank
see you
you.
soon.